When a patient's initially referred to me, often I'm the first specialist that patients will see. So I'm part of their cancer journey from the very beginning. My role is to look after patients that have cancers arising from the urogenital system. So primarily that means treating patients with prostate cancer, kidney cancer and bladder cancer. But I also look after patients that have testicular tumours and lesions arising from the adrenal gland and penis. I was fortunate enough to spend 2 years in the United States with a fellowship dedicated to robotic surgery. And that's given me the opportunity to now offer the most advanced robotic techniques to patients with prostate, kidney and bladder cancer. If they do indeed have cancer, then my role is to discuss not only their surgical options, but their non-surgical options for treatment. And if they do opt for surgery, then here at Lifehouse we have the most advanced surgical robot, the Vinci Xi. So we're able to offer our patients the most cutting-edge robotic surgery to optimise their oncological and functional outcomes. So the benefits include keyhole approach. So there are only very small incisions on the patient's abdomen. So that means that their post-operative recovery is fast-tracked, so they have less pain, they're able to get out of hospital quicker, and they're able to return to work and normal activities as quickly as possible following the surgery. So we're able to offer the most cutting-edge robotic technology for our patients here at Lifehouse. And we owe a lot to the donors that have made acquiring the dual console Da Vinci Xi possible for Lifehouse. So as a surgeon, I like doing things with my hands, and so I'd have to say that the most enjoyable part of my job is being in the operating theatre, performing interesting, complex operations, especially if I get to utilise the Da Vinci Xi robot here at Lifehouse. When I was first starting my surgical training, major oncological operations were performed via an open approach with quite sizable incisions. Urology was really the first specialty that embraced robotic technology, and that allowed us to perform very complex operations in a keyhole manner to really get the best outcomes for our patients, and that certainly was a driving factor for me choosing urology as a specialty. I'd have to say that the most rewarding aspect of my job is when I see patients after their surgery, and I can really see the impact that the surgery has had on their life, obviously from curing their cancer, but also to seeing them recover as quickly as possible from their surgery and being able to maintain their quality of life after their operation is really a rewarding aspect of my job.